This is Jonathan Troost from the University of Michigan here with two of my colleagues to discuss our article on outcomes-based definition of proteinuria remission in focal segmental glomerulosclerosis, which was recently published in Gipson.
Hello, this is Howard Trachtman from New York University.
Hello, this is Debbie Gipson from the University of Michigan.
In our study, we examined the relationship between short-term changes in proteinuria and long-term kidney survival among children and adults with FSGS. Our goal was to determine if reductions in a patient's proteinuria were associated with better kidney survival, defined by loss of estimated GFR. If so, what specific thresholds of change in proteinuria were associated with better prognosis. In our initial cohort of primary FSGS patients enrolled at the time of their first kidney biopsy, patients whose proteinuria returned to normal were extremely unlikely to lose estimated GFR during follow-up. This wasn't surprising. We also looked at patients who reached the conventional definition of a partial proteinuria remission after 4 to 8 months, defined as a urine protein to creatinine ratio less than 3.5 grams per gram, along with a 50% reduction in proteinuria from baseline. However, patients in a conventional partial remission had comparable kidney survival as those with no remission of proteinuria. We then conducted a series of analyses to determine the optimal proteinuria reduction threshold to predict kidney survival. Our study found that achieving a urine protein to creatinine ratio less than 1.5, along with a 40% reduction in proteinuria from baseline, was associated with better kidney survival.
These results were generated from a group of patients across North America with diverse ages, ancestries, and genetic backgrounds enrolled in observational studies, a clinical trial, and electronic health registries. Across this heterogeneous group of patients and studies, reducing proteinuria below 1.5 was consistently associated with a better long-term outcome compared to those with sustained proteinuria greater than 1.5. Clinically, this is an important finding because it provides additional evidence that a meaningful reduction in proteinuria is associated with slower disease progression. This intermediate outcome of proteinuria less than 1.5 gives us an alternative, more feasible treatment target instead of only aiming for the strict goal of a complete remission.
Given the lack of therapies for FSGS, these findings can help in the design and conduct of clinical trials. It will be important to test whether the metric that we have defined is applicable to other disorders such as membranous nephropathy and IgA nephropathy, in which, like FSGS, podocyte injury is a key component in disease pathogenesis. A final point worth highlighting is that this research was performed as part of a public-private partnership.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.